So the next thing we're going to do is we're going to talk about what does full legs mean. So we've talked about a lot of areas, but what we haven't talked about is legs. So legs are a really, really common area that we air sculpt. Let me tell you what legs means. Legs means your inner thigh, which is probably what, besides tummy, the most common thing we do. So inner thighs are, I'd say, 70% of women's trouble spot. So we do inner thighs in every office every day. And how do we do that? Well, we do them with the patient's knees. Everyone says, well, my knees are fine. Well, the problem is proportion. When you have a bigger inner thigh, the knee matches the inner thigh. And when you combine the inner thigh and the knee together, you have what's called a cosmetic unit. And what that means is if you do one, you have to do the other, or it's going to look disproportionate. So on the patient that you're going to meet today, her name's Vanessa, by the way. When we see Vanessa, she's having her inner thighs and knees done, and then she's having her saddlebags done, or outer thigh. Now, outer thigh isn't hips. Hips for us is kind of like where your hip bones are. Outer thigh is kind of the area that on some people sticks out. A lot of women complain that it really bothers them in yoga pants or exercise gear, etc., or just it's hard when they pull up their jeans get stuck there. Some women are super skinny and they just have outer thigh fat. I've seen that many, many times. So that can be a major trouble spot. And when we do all this, we also combine it with an area called banana roll. Everyone asks, what does banana roll mean? I've never heard of that. It's actually a term used in plastic surgery for fat underneath the butt. It's kind of like the back of your inner thigh. And we always do it to complete the picture because it gives you more space between your thighs. A lot of people come to us just because their thighs rub and summer's coming and it's hot and uncomfortable and they just want their thighs to not touch. And Vanessa is a good example of we want our thighs to not touch anymore. So that's what we're going to accomplish. Also in a bathing suit, when you do banana roll, everything looks much better and it makes you look, you have what's called a diamond zone. What's a diamond zone? A diamond zone is you have one butt cheek here, that's the top of the diamond, and then the inner thigh and the inner thigh, and that creates a diamond. And some people really go after that look, especially where we are in Miami. That's a very sought after anatomical feature. But for us, what we care about is making our patients comfortable, and no one really likes their thighs rubbing. So that's how we achieve that, and that's what we're going to see today. A couple other things I want to mention before we go live is that we are going to be rolling out a AirSculpt Ambassador program, and that's going to be rolled out in the first week of July. And what does that mean? Simply, we have so many happy patients, for example, Victoria, who you just met. When our patients refer other patients, then we give you credit if you want an additional procedure. And all the details will be coming out in the first week of July, but we've been working on this for a long time, and I wanted to mention to everyone that it's finally happening. So let's go live to Denver, and what we're going to do is we're going to start by showing you the Denver office, because I don't think anyone's ever seen how beautiful it is or the look of the interior of an office. We just show you the operating room. So today we have Karen there, who's our patient care coordinator, and she's going to show you around a little bit, and then we'll go to the operating room. So let's go to Karen, okay? Hello.
How are you?
Good, how are you? Thank you for doing this, Vanessa. It's amazing.
Absolutely, absolutely. I'm happy to.
How has it gone so far?
Great. I'm like super comfortable and relaxed and just chatting it up with the nurses and having some fun. I'm so relaxed right now.
I'm so happy to hear that. How much fat have you got now, doctors, to do?
Well, out of the right medial thigh, we've done about 400 so far.
Oh, let's see it. Can we see the fat curve?
Of course. So look at that.
Okay, so So that's one inner thigh and knee, it looks like.
Just
That's
one
great.
inner thigh and knee, not even the outer thigh yet, which is incredible.
That's great. And Vanessa, how did you hear about AirSculpt?
Well, I'm an aesthetic nurse, and one of my clients actually told me that she did this, and I'm familiar with cool sculpting. I'm not a fan, and so I wanted to check you guys out. And after I talked with my client, she told me that you guys were in Denver, and I live right in Cap Hill, so about 5 minutes from you guys. So I popped in one day, and then the rest is history.
That's wonderful. You've been so kind to share this experience with other people. Now, when you had cool sculpting, how was that experience? What kind of result did you get?
Honestly, the experience itself wasn't bad. It wasn't too painful, but like I just didn't see a drastic change. I'm not saying the science isn't there, but it's just for the amount of money you pay for, most people want those drastic results. So
Sure.
I just I don't feel like it gives that. You know what I mean? But I mean, you know, it's a great alternative. Again, that's not invasive. So for people who are
Sure.
invasive.
Of
But
course.
it's very subtle. It's very subtle to where sometimes you're like, I don't really know if it did anything, you know?
Yeah.
So,
Not the first time I've heard that. So
yeah.
what we're going to do now is we're going to go live with your, first of all, one of your inner thighs is done, right?
Yeah.
So I want you to actually take your hand with the glove on it and feel the difference when you pinch it. Since you're an aesthetic nurse, you'll be able to feel that subdermal fat layer and see how much fat is left on your inner thigh.
Right. Do you want me to do that right now?
Yeah.
Okay.
You literally just finished that thigh a couple minutes ago.
Yeah.
So that's not your result at all, but I just want to, there's such a dramatic change with AirSculpt. It's not a fair fight. It's a totally different story. Like, it's not ambiguous, right? This is like a very dramatic change between one and the other.
It is immediately dramatic. I can absolutely tell.
Wonderful. Okay, now let's start your other thigh, and we're doing a chit chat while you're having it done. So, Dr. Zadu, you can start air sculpting her other thigh, and you know what we're going to do, Vanessa, is just ask if anyone who's watching this wants to ask you a question. Go ahead. So, what do we got?
Okay.
And she is in the Denver location. So if you guys want to come on down and get a consult here in Denver, this is where it all happens.
Thank you, Karen. Okay, what are our questions, Lauren?
Hi, Vanessa. So some of our fans are asking you how you're feeling right now, how the actual procedure is feeling.
Literally, they said, does it hurt?
Yes. No, it does not hurt. I am like literally in the best mood right now. You know, my nurses and everyone is super friendly. I'm so comfortable. There's no pain whatsoever. I just feel like vibrations, honestly, because the numbing just takes all of any type of pain away that could potentially be there. But I don't feel anything.
A little bit of tickling, but
Tickling,
I think that's
oh
all
yeah,
you complained about.
Tickling by my groin, and that was really all that there was.
That's plus or minus.
Yeah. So it's I mean, it's not painful at all. I'm so happy right now, you know.
Oh, thank you. Wait, here's another question. Will there be loose skin? Well, that's a question for me. Well, with AirSculpt, your skin will always be tighter than it is when you started. It will not be looser. So we are tightening her skin as we do this. So that's a very important point, and it refers to any AirSculpt procedure, not just Vanessa's inner thighs, but everyone worries about loose skin. If I was having a procedure done, I'd worry about it too. But the skin tightening with AirSculpt is one of its strongest features, and one of the greatest benefits that we get is your skin will actually be tighter than it was when you walked in this morning. Let's see, here's another question. Do you feel a tugging? Do you feel the instrument moving under your skin?
You know, I just feel the vibrations. I don't feel like there's really no pain involved. Yeah, I mean, I can feel it go up because of the vibrations. I can feel where it is in my body, but it's not like a weird thing at all. It's just I can feel when the probe moves from one area to the other just from where the vibrations are coming from.
Okay.
Yeah.
You know what? Let's talk to Dr. Zadu. Karen, would you point
Sure.
me at Dr. Let's show what's going on with the Aeroscope procedure. So show, there we go. Show her leg and show Dr. Zadu.
Hi, Dr. Zadu. Say hi to the crowd.
Hi, Doc.
Working on Vanessa's medial thigh, way in the upper part, the part that drives all women crazy.
Well, we can't hear him very well, Karen.
Oh, you can't hear him? Okay.
Perfect. There we go.
So we're working on the upper inner thigh, and especially that most top part that drives all women crazy when they pinch it. So our goal is to not have her be able to pinch it and bug her.
Wonderful. And were her thighs touching before? Does she want her thighs to not touch anymore?
Yes, she was.
Yeah, they were touching, which it doesn't bother me. I like thick thighs, but it's just gonna be a better shape for myself. You know what I mean?
Perfect. Yeah. Yeah.
So,
That's our aim exactly.
yeah.
Is-
I don't want like a no gap. Like I'm fine with some touching, but there was definitely thighs touching together, and we'll see how it turns out after. Either way, like I love curviness. It's all about just kind of contouring where
That's
I
what
want.
we're here to do.
You know?
We like to make people more curvy, not less curvy.
Yeah, exactly.
Okay.
She's a great spokesperson for us.
Did you hear
She
that?
is. She's actually, Vanessa, you're a great spokesperson for us.
Yeah.
Thank you.
And then
Any thoughts on AirSculpt, Dr. Zadu? Anything you want to tell people that are watching
No, it's fine. That was way better, yeah.
that you come across?
I can tell you that I had trained years ago with traditional liposuction, and I won't ever do that again.
I love hearing that. Okay.
Technology is just so superior.
It is, yeah. I don't think it's fair. I feel like doing liposuction is malpractice when this exists. It's just not fair. So.
And they're more comfortable. They go home, they go to work very quickly.
Yeah, I have work tomorrow, and I'll be there.
Good.
I'm going back to
Wonderful.
work right tomorrow, so.
Wonderful. And
Yeah.
we would love to see your results when you have them, So I love following up with people. So we're definitely going to ask you if you don't mind showing your legs, your before and after on your legs. That's what we've been doing every week. So
Yeah.
this has been wonderful. Any other questions from people watching before we let them be? What's that in her hand? Oh, what's that in her hand? So
yes.
she has that's laughing gas. And we give people the opportunity, if they want to have laughing gas, to have laughing gas. And the reason is because it's fun. It's not like a David goes to the dentist level of gas, okay, where you don't know your name. It's just enough. I want the procedure to be fun. Have you been listening to music?
I mean, yes, but we've been chatting in here the whole time, too, so.
It's kind of like, I want it to be like you're going to a spa, having a couple glasses of wine, and just getting skinnier.
That's exactly. I feel
Good.
very relaxed, chilled out. This helps,
Cool.
It's good. Yeah, it's all good.
Yeah. Wonderful. Oh, do we have one more question before we go?
Yeah, so someone wants to know how you feel about actually being awake during this procedure.
I love being awake. I mean, the whole thought of being put under anesthesia is very not comforting for me. I wouldn't have done this if I had to go under, just because that whole thing scares me. So being awake, it's, we give feedback back and forth. I'm able to tell them I told them to put a little more numbing in one area just because I could feel it a little bit. And that's what it's all about, is being able to explain, how I'm feeling, so we can just have a really overall.
Perfect. We want you to be an active participant in your procedure.
Yeah, exactly.
So that's wonderful, actually. That's what.
So it feels
that's what we want
good
to do.
to be awake and be interactive, and I don't feel out of it at all. Like I feel just
Good.
like my normal self right now.
Yeah.
Yeah.
Thank you. Thank you so much. I really appreciate it. What, Dr. Zadu?
I just want to comment on the awake part. It actually is safer for us as surgeons because we know where we are inside the body better than if they're completely asleep. And that's a big deal.
Another thing that when I operate that I like is you can tell the patient to move in a certain way so you can get to every corner, every nook and cranny, leave no stone unturned. When a patient is asleep, they're like a sack of potatoes. And
Right.
it's
I've
very
kind of
hard.
been like moving to help him maneuver certain.
I love that. It's a
Yeah.
dance. And
Yeah.
you cannot do anything like that under any form of anesthesia.
No.
So thank you so much. You've been an angel. I really appreciate it.
You
Thank
guys
you,
are all
Dr. Satu.
angels. I love my team here. I'm so happy.